Hello, I'm Nicole Monica with the Nittany Health Communications Department, and I'm pleased to bring you conversations on important topics at Mount Nittany Health with subject matter experts from our health system. Over the next few weeks, our video series will focus on an important topic to many of us, COVID-19 vaccines. And I've invited a number of our physicians and nurses and employees to speak with me on questions that I've heard from employees and others about the vaccine. For today's video, I am pleased to talk with Dr. Ishmael, Allergy and Immunology Specialist with Mount Nittany Physician Group. Dr. Ishmael is board certified by the American Board of Allergy and Immunology. Dr. Ishmael received his medical degree from Penn State College of Medicine, completed his residency at Penn State Milton S. Hershey Medical Center, and completed his fellowship at Johns Hopkins University School of Medicine. Among his many accomplishments, Dr. Ishmael was a tenured associate professor and director of the Severe Allergy Clinic at Hershey Medical Center. Dr. Ishmael is also associate editor for the Journal of Translational Genetics and Genomics. Welcome, Dr. Ishmael. I am grateful for the opportunity to speak with you today about the COVID-19 vaccine.
All right, well, thank you for having me.
All right, Dr. Ishmael, many people, including our own employees and physicians, have already received the COVID-19 vaccine. But for those who haven't, I had a few questions that I was hoping we could talk about regarding the vaccine and really any long-term effects of the RNA aspect of the vaccine. So that's really our subject and where we're going to get started. Could you explain to me how the COVID vaccine was produced? And is this production timeline considered normal?
Sure. So there are a few important things to keep in mind with the vaccine. First of all, we had a lot of data with the original SARS virus. So it wasn't like we were starting from scratch. We already had some things to build on. Another important thing to keep in mind is that when this pandemic happened, just about every lab that could do COVID research was actually doing research. And when you look at the number of person hours that went into this, and you combine that with the fact that we have more technology today than we've ever had, we really generate a year's worth of data within a few months. And when we talk about vaccine development, that's really important because a lot of the time it takes to develop a vaccine is really learning about the virus. In this case, we had the virus sequenced actually at the very beginning, even when this first started to emerge in China, the first sequences became available. So the science that went into this really was based on things that we already had in place. And the vaccine, the type of vaccines were such that we could apply that very, very quickly. So the second part of this, once we understand how the virus works and how to target it, is setting up a study to determine whether these vaccines are safe and effective. And it turns out that part was really standard. So most vaccine studies, there's about a 6-month time frame where you administer a vaccine, you measure side effects, how people respond, and then you see how they do over the next 6 months or so. So in that sense, this was really no different from any other vaccine that we've had. And we can very definitively say that these vaccines were not rushed at the expense of safety.
Okay, thank you. That is very important. And I wanted to ask you about one of the buzzwords that's out there quite a bit in the media, a new term that we all are learning, but it's this term mRNA. What is it and what happens to RNA from the vaccine in the body?
Yeah, so I think most of us are pretty comfortable with DNA, right? So DNA is our genetic code. And the way I think about it is imagine you have a book, right? DNA are the words on a page that basically tell the story. They tell us what to do. They basically, dictate how our body. Well, RNA is kind of like a schematic. Imagine it's a figure in that book. It's a way to take that written text and actually put into something that we can use. So in a lot of ways, RNA is a schematic. It's kind of like a blueprint. It allows us to take those words and actually make something out of that. And in the case of viruses, because viruses are small, they don't have the same capacity in terms of storage space than a human would, a lot of viruses actually use RNA as their genetic material. So they basically carried these schematics instead of a whole book. So the vaccine is basically a schematic. And essentially what we're doing is imagine, let's say for argument's sake, the coronavirus were a car. The mRNA vaccine is basically a schematic that tells us how to build a little piece of that car. Imagine it's a wheel. So when you get the vaccine, essentially what you're doing is you're taking this blueprint. Our own cells act as a factory and they build that small component that information is providing to those cells. And essentially now our body will see that wheel of the car and we'll make antibodies against it. And so if we ever see the COVID virus, those antibodies are able to recognize a part of it. So there are a few really important points about this vaccine. First of all, you can't get infected with it, right? You're only getting part of it. You don't have all the information you need to make the whole car. You only have the information to make a tiny little portion of it. One of the other things about RNA is that it's really, really unstable in our own immune cells. So basically, our cells make the wheel, our immune system reacts to it. And this vaccine, the RNA itself, is destroyed really within about 48 hours. So the likelihood that this could lead to a long-term side effect or a long-term issue is incredibly low because it's just not there longer than a couple days. The other important thing is RNA can't alter DNA, right? So this, like I said, is a schematic in a book. It can't do anything to change those words. So the idea that this RNA could change something in your body genetically just doesn't happen. So in some ways, it's really the best case scenario. You have a vaccine that's very effective, but it's also short-lived, and you get the best of both worlds.
Wow, that's really helpful. And that description of the schematic in a book and the words referencing the DNA, that was really helpful for me to think about how this vaccine works. But I'm curious, is this the way that other vaccines work in the body?
So really, every vaccine that we get is the same idea. Either we see part of a virus or bacteria and our immune system responds to that little piece that we see, and therefore we get protection against that microbe. Or it's a vaccine that may have a complete virus, but you do something to either kill it or inactivate it. So really, it doesn't matter whether it's an RNA vaccine or a protein vaccine or a live viral vaccine, the end result is really the same thing.
Excellent. Protection, right?
Exactly.
Ishmael, this was highly informative. It really helped me to think about and to understand how the vaccines work, the safety, the efficacy of them. Is there anything else that you would like to add as we close our video today?
Yeah, I think the biggest thing I hear in clinic is whether I think the vaccine is safe and effective, and if I have concerns about side effects. And the first part, I would say yes. There's no doubt that this is safe and effective. Since these vaccines were rolled out in December of last year, we've vaccinated hundreds of millions of people worldwide. And there's been a tremendous amount of data collected regarding safety. And we're not seeing any significant side effects. And in fact, in some ways, the side effects we're seeing are really less severe than some of the other vaccines that we already have available. Um, and when you actually think about even the initial studies that led to these vaccines being FDA approved, we do not have long-term data, right? These studies are now more than a year and a half old, and data has continued to be collected on the initial subjects. So we do know that there is also long-term safety, and there are no concerns from that standpoint.
Well, that's really helpful, and it's helpful to hear that from you, Dr. Ishmael, regarding the long-term safety of the vaccines, because that is a question that I know that I hear, and that needs to be answered by our physicians, by our clinicians who are closest to helping us make these decisions. So thank you so much for your time today. I know you have a busy schedule and are taking care of so many people in our community with your work. So I just want to thank you for that, but also thank you for taking time to talk with me today and to have this conversation regarding the COVID-19 vaccine. Again, I'm Nicole Monica. I'm the Communications Department at Mount Nittany Health. And I just want to take a minute to remind anyone watching this video that as an employee at Mount Nittany Health, you can get the COVID-19 vaccine by calling Employee Health Services, and that phone number is 814-234-6731. It's free, it's easy to sign up. Again, just call Employee Health Services and they can help you. It's 814-234-6731. We're going to continue these conversations regarding the COVID-19 vaccine with a number of our nurses and providers that continue to take their time to help us to answer these questions through this video format. So we hope you'll join us for that. Dr. Ishmael, just want to say again, thank you for your time and everything that you're doing to serve our community.
You're welcome. Thanks.